Going to be an informal session, and we'll chat and talanoa and have questions which we will share. But let me just introduce our panelists. So Dr. Julie Wharawira-Mika is a mental health practitioner by trade, and she is a Māori researcher. She's also Commissioner for Mana Mokopuna, and she is co-director of the Medical Assurance Society Foundation. We have Afoa Tevita Malolo, who's a lawyer by trade, but he is the general manager at the Tamaki Regeneration Company, and that's one of New Zealand's largest affordable housing developments. So it'll be very interesting to listen to you, Afoa, later on in the evening. And my friend, Dr. Owen Sinclair, who is a frontline paediatrician out west, and he's also a researcher and a teacher, and he's president of the Paediatric Society of New Zealand. And down below Owen, I have Dr. Simone Watkins, who's another friend of mine, and she's also a frontline paediatric doctor, a senior registrar, who is also a PhD student and just about completed her PhD thesis. And then last but not least, we have Dr. Analosa Biokiso Ulungia, who I've known for many years. And Analosa has a social work background a long, long time ago. And then she got into youth health and into research, and she completed her PhD looking at Pacific youth health. And now she's a postdoctoral fellow. So we have a great group here to help us think about children, in particular Pacific children. And I guess the purpose of tonight is, about a year ago, we had a conference in Auckland, the Pacific Child Wellbeing Conference, and there were about 300 people that came along. And we looked at the strengths and challenges that our Pacific children and their families were facing. And we also produced a document which essentially set out some things we should be trying to do to improve, I guess, the lives of our Pacific children. And they were things like access to education that connects children to their culture, affordable housing, finding a way to build intergenerational wealth through home ownership, reducing poverty, accessing healthcare, those sorts of things which are not unexpected. And I guess what we want to do tonight is we just want to pause for a moment. We've been going through a lot as a country and a lot as communities, and just reflect on how things are going for our children. What are the challenges that we're still facing, the things we need to be focusing on? And I guess along with that, what are some of the great strengths? What things are going well and what are we doing well? So I guess if that's okay with you, I want to start with one of my frontline colleagues and just put to you the question, Owen, if that's okay. In your role as a frontline paediatrician, you've been doing this for decades in hospitals and clinics and the community. When you think about Pacific children and Māori children and their families, what do you see as the big challenges that just keep being in your face every day?
Yeah, tēnā koe tuila, thank you for that. So I think the biggest challenges that both Māori and Pacific communities have are poverty, in short, like that sort of thing. So they have less of everything, and poverty is directly related to poor outcomes in health and access. And I don't think people really understand. Many people who are making policy have never lived in very poor circumstances. I was unfortunate to do it, but we're out of it, and quite how pervasively bad it is for your health in any way, shape or form. And then that moves on to why is poverty like that for these communities? And again, the majority think that it's because they play pokies and drink, and that's just rubbish. We see these beautiful whānau who are just struggling against everything. Being poor is really expensive. It's really hard to be poor. And it's just everything, if you're wealthy, you get all these advantages. And so there's these systems. And so you tend to live in the places where there's slightly worse schools and your job security is poor, and you don't have communication security, and you don't have transport security. And then everyone gangs up on you for not turning up to this, that, and the other thing. But the person who had the car is out earning money to pay the rent and all that sort of stuff. So I think that the poverty and ingrained poverty that's systemic, and the systems that stop people advancing their lives, no matter how hard they work and no matter how conscientious they are, I see as the biggest problem for both Māori and Pacific communities. Kia ora.
Thanks, Owen. Simona, would you agree with that? I mean, is that what you see too? And what do you think? Do you think anything's changed in the time that you've been a pediatric doctor?
Yeah, so I agree with Owen. There's lots of ways that poverty and poor access to care can influence our families, but I do want to state two important things. So one is that access to care, there's a myth that our Pacifica people don't access care. And actually there is research saying, for example, in rheumatic fever, that our families are accessing care on multiple occasions. And so my question is, why is this not translating into the kind of health outcomes that we would like? And the second thing is that on a positive note, I've seen some really excellent programs instituted in different parts of the country where they're really trying to match our services to the family needs. So for example, when they've got pediatric outpatient appointments, try and make sure it's at a time and date that suits the family. Like Owen said, you know, make sure that they've got childcare when they're from larger families and they're trying to juggle all these different things. So I think that from a systems perspective, we are trying to put less of the onus on the family to match our systems and trying to adapt the system really to meet more of these needs of our whānau. And so I think that's quite promising in where we're going.
Yeah, I think I agree. Sometimes we need to shape the systems and the services to better meet what we need. And also you work more in the sort of youth space, I guess, and you've done a lot of stuff in the community. Have you come across ways that we're adapting or changing our services or designing them to better meet the needs of our people?
Yes, I think, you know, there's some fabulous initiatives that are happening, and one of them is, for example, the Village Collective, who are based out of Druces Road in Whitty, Manukau. And, you know, we talk about the term in terms of co-design, but it's something for us, you know, that has been always implicit in terms of how we practice in regards to, you know, connecting with those, finding out what the needs are, working together in terms of solutions. And so the team, you know, journeyed alongside the young people to go, hey, look, what would be helpful? What would you like? And so together they actually developed and designed, with the support of Te Whatuora, you know, in terms of their own youth one-stop shop. You know, and they've actually got their own facility, you know, on site that young people, because the young people didn't want to, you know, they wanted a different place to hang out rather than school or, you know, at home or the mall, you know, and so they wanted to go to a neutral place that they could connect with friends. And one of the kind of top things that they mentioned was actually, you know, we'd love, you know, some PlayStations. And slowly but surely they've been able to grow in terms of the resources that they have, that they're actually offering in terms of, you know, like, you know, computer labs where young people are able to come, you know, book a laptop, book a computer, do some work there, connect with others, you know, safe kind of spaces designed by them, for them, with them. So, yeah.
Thanks for that. Julie, can I come to you? I mean, you have quite a broad view of what's going on and a strategic view as well. Just listening to the others, and we reflect on that terrible, I guess, continuing issue of poverty and how that impacts our families. How are we going to do something about that? What is the way forward to try and do something around the continuing poverty that our families face?
Kia ora tuila, great pātai. And I just want to acknowledge the awesome work of Moana Connect in developing an advocacy report specifically for Pacific Child's wellbeing. So I think what's been really great with the report you've produced is you've collated a whole lot of evidence that supports the recommendations you've provided. And I guess from my perspective, thinking about the broader landscape, the most significant concern for children in Aotearoa is the urgent need for targeted action and investment into their wellbeing. And as Dr. Owen Sinclair's mentioned and others also, our young people are grappling with significant challenges such as child poverty, housing affordability, food insecurity, complex factors affecting school attendance like mental health issues, bullying and hunger, and urgent targeted action is needed to address the disparities faced by Pacifica children, Māori children and our children living with disabilities. In addition to that, there's a lack of data on the wellbeing, particularly for Pacifica children, so that raises concerns about how we effectively monitor outcomes for our young people as well. And I guess my kind of broader solution to that is the urgent need for cross-party commitment and long-term cross-government approaches to ending poverty and implementing effective policies. We need something that's going to be long-standing, that's going to, be a change and transformation maker for our children, for our grandchildren, and for their grandchildren moving into the future.
Yeah, I think that was identified in the report, the sort of multi-layered. We need to, I guess, some policies which are promising, we need to sort of continue with those and then develop other ones. I think one of the areas that is a big driver of well-being and health for our children, and also the continuing poverty issue is housing, and getting our families into housing which is not just a box, but a healthy home where they can thrive, that suits our families, our big, multi-generational families. You have a wealth of experience in this area. Can you tell us a bit about what you've seen and what you're doing in your role?
Tala Whatu William, thank you. Yeah, look, I just want to firstly acknowledge the kōrero that's already happened, because I think, child poverty and access to, warm, dry, healthy homes and to education and to healthcare are really important. I guess one of the emerging things that we're seeing, and particularly in the urban development space, in urban areas like Auckland and some of our other cities, is I think density is going to be a real issue for our communities. And so what we're seeing is the way that we live is changing. We're moving towards, I guess, medium to high density type of living. We have more terraced housing. We have more clusters of houses, as opposed to forms of housing in the past where you would normally have a backyard and a front yard and a shed at the back. That's changing. And so some of the things that we're starting to see in our communities is the way that we place make, the way that we live within communities, and all of that has a ripple effect on how children or how our whānau are engaging with each other in communities. And I guess, there's a huge drive in the housing sector for us to increase the supply of housing into our urban areas, and what that looks like from a built environment or a typology environment is, more apartments, more terraced housing. And, frankly, if I'm being honest, a lot of our communities do not have, I guess, the education, or they're not being educated about how to live in this type of environment. Safe to say, this is probably 10 years away, but it's as we've been developing out in the Tamaki region, here in Tamaki Makaurau, we're starting to see some of that tension sort of play out in our communities. I guess from a housing perspective, as we know housing is a catalyst for a lot of positive, I guess, social outcomes for whānau, and we're already starting to see some of that, whānau that are moving from our old state or public housing into brand new homes. We're seeing, anecdotally, we're seeing evidence of less visits to the GP or to doctors. We're seeing an increase in, I guess, education outcomes because they're able to study in a warm environment. There's there's benefits of good housing that are having really good impact for whānau. The flip side of it is, as I've said, is we're starting to deal with density that is going to impact whānau. And one example is we constantly get complaints about parking or the neighbour that's doing kapahaka practice in the backyard, and that's or people listening, or people can hear their next door neighbours running up steps. It's going to be a very different environment, and one that's going to require quite a bit of thinking. I guess one last point is we also need to build the appropriate social infrastructure in our communities, and that means more early childhood education centres, more community-based health centres, things that are connected to our high schools or to our primary schools that will better serve our children, and that requires a huge effort from both community, our agencies and government to tackle that.
And Tuila, can I just add, in terms of, thank you, Te Vita, because I just wanted to sort of, one of the points that you made, in terms of our families and in terms of, my social work experience, background, definitely, like our families are multi-generational. And so, when we're talking about density housing and the split levels, real great concern coming through in terms of how did we help our mamas and our papas navigate, stairs, and also even like we know in terms of, as Owen shared in regards to poverty, and housing affordability, especially in the current kind of climate, and those kind of all the various effects from that.
Yeah, I'd echo that too. I mean, I'm a sort of an aspirational paediatrician, and I see children, and I think about what's best for them, and what's best for children is to be with their big families, to have their grandparents living in the same house as them, and to have somewhere to play, and I know that's very aspirational, and it probably doesn't fit the budgets that we have to work with, but it's frustrating because we know what's good for children, so why don't we do what's good for children? So why can't we build houses where our grandparents can have a room downstairs, and you know what I mean, for what I'm getting at? Really not some money, of course.
No, and the benefit of tamaki regeneration being place-based is that we can respond to community needs. So we are in some ways under some constraint, but we're still we're trying to build houses that meet the need of our community. So we are building larger homes. We'd like to think that a 4 or 5 bedroom can cater for an intergenerational living. But the reality is that everybody needs to make a dollar. And unfortunately, the people that are making dollars are not people that look like us. And so, the bottom, there's always constraints about what we can build and how much that's going to cost. And I think we need to be, I guess, a bit more innovative in this space around how we build appropriate housing for our whānau, right across the housing continuum, and housing that is, I hate using the word affordable, because nothing's really affordable right now, but housing that allows whānau to step into some form of ownership, whether it's through a rent-to-own or whether it's through shared home ownership. There are stepping stones into a housing product where whānau can enjoy the intergenerational benefit of having that wealth as well.
I think the housing thing is systemic of the systemic nature of ingrained poverty. It's a landed gentry, so the system now treats both land and property as a currency for Pākehā mainly to get wealthy rather than a need and a right for all of the people. So you and I both know you can't have healthy, active people unless they live in decent homes, but the system is currently designed to treat as a home as a retirement option for someone else who owns it. And it's we need to look at ourselves in a society, even those of us who own investment properties, you know what I mean? You need to sort yourself. I mean, it's part of the systemic nature of this ingrained poverty that just traps Pacific and Māori in this cycle of debt that they can never get out of, you know?
Mm.
I think home ownership's really critical, isn't it, Alpha? And I know that you have some programs to try and help families with home ownership, and that's a way to build that wealth, hopefully. I want to just move on, perhaps. You know, we're in the beginning of a new government, and they're finding their feet and changing policy or bringing in new policy or continuing with policy. And I guess I want to put to you all, do you see some good opportunities in front of us, bearing in mind that we're not entirely sure what the policy platform is going to be like over the coming year, but do you see any great opportunities with this new government, or some big challenges? So either of those things. I'll start with you, Owen, because you're nodding your head.
Yeah, I'm alarmed by this new government. They one of the most ideologically driven governments that I've ever seen, and I think, you know, that lots of things that just horrified me. One of the first one they did was they killed 5,000 people with a policy. You know, they got rid of the anti-smoking law and this sort of stuff. So if they're prepared to do that, and they also have this sort of this pathological hate of doing a policy to help people based on their ethnicity. So we know that both Māori and Pacific face these challenges, and they need specific case problems, but they appear to be just almost pathologically, despite all the evidence, opposed to it, and it just horrifies me. And I think we're just going to have to sit here and weather out the storm. I'm sorry, a lot of what they're doing just horrifies me. I'm just looking at it going, oh my God, like this sort of stuff. So I'm sorry to be the first negative Nelly at the beginning, but that is how I feel. I'm sorry. And I'm not quite sure how we navigate around, because we have to do something. We have to minimize the damage, I suppose. And we've lived through it before, but
Yeah. Sometimes we have to hunker down and look for the positives. But Julie, you've got that strategic sort of wide, broad view, and you've been here before. And often with new governments, we just have to look, you know, be patient, look for the opportunities, don't panic. What's your thinking?
I can definitely share some of the frustrations that you've voiced, Owen. What is challenging is that a lot of evidence-based initiatives that we know are going to make a difference to the inequities our people suffer have been abolished, and I think that's quite painful when we know the wider impact that's going to have on our children. Just talking about, you know, like food in schools, you know, simple things like that we know make a big difference for the broader well-being. I think, yeah, it's a really hard thing to live with, but trying to find that silver lining, like Tuela said, is really important as well. You know, we got to look at how we can work alongside government to ensure that we can continue to move forward to support the well-being of our children, particularly our Pacifica children and our Māori children who experience the most adversity in our health system. One of the promising things I've heard them say is that they want to boost frontline services, and they want to devolve a lot of funding directly to communities. And I guess when I think about initiatives that have been really successful for Māori and Pacifica children, they are ones that are led by our communities. So I hold on to hope that that might be a priority and a focus that our government chooses to invest in. And, you know, we've seen some really great examples in communities where our people with very small resourcing can do really impactful things. I was thinking about the Pacific Autism Support Group, for example, that was led out of a whānau need to respond to the needs of their children, and how that network grew really rapidly. And last year they published a book, Pacifica, Our Autism Journeys. And I just think that's such a wonderful resource to be able to share widely. And I went to the launch of that book and was so proud to be able to share that with other families I knew that were struggling in those spaces. Yeah, but there's always, you know, opportunities that we can work alongside and support government and steer them back into the right into the right path. But I do agree with you, Owen, it's a really hard pill to swallow at this time, particularly when we are hearing of critical roles being disestablished, critical organisations being disestablished, that we're kind of set as paramount organisations to respond to the inequities of Māori and Pacifica children and have some intergenerational impact as well.
Well, I think it was relevant to immunisation, isn't it? So they just last week stopped the free immunisation for Māori and Pacific to 50, and also tamariki up till 12. And I know for a fact that that wasn't a consulted policy. It didn't go to the committee in Whāmek who decided that. It was an arbitrary one. So it's a worry, yeah.
Yeah, I guess some of the possible opportunities though are devolving, and hopefully we're going to see more community-led solutions, but it's it's going to be a waiting game, isn't it? Simone, what's your sort of thinking and take on how things are going?
I just echo those two comments really about the grief. I think that's very real grief about kind of the 2 steps forward, 1 back. We'd been making some progress in some of these areas. But I guess the positive that I see through this is the talking point, and specifically in the healthcare professionals, we've had a rough ride over the last 5 years. I think all of society has, with the COVID pandemic, and to a point, even the general public, I think, are very more clued into things like evidence-based medicine. They want to understand these things, and I think that helps us generally as a society. And also I see through the pandemic that the inequities really, people had to face those who wouldn't have had to really look at that previously maybe as hard. And I can see people asking me and wanting to converse about, what they can do as allies. And I think we can hold some hope that there's some good people out there who potentially don't agree with some of the polarizing things that are coming out of this government. So yeah, I'm still hopeful that, we can ride this out, and we're continuing to build the next generation as well, who who are very open to trying to do things differently. So that's my 2 cents.
The other thing too is we whatever's happening externally with funders and policymakers, and we can always turn back to our community, and we can stop and think about what are the great strengths in our community, because there are great strengths no matter what is going on around us. And Aotearoa, what's your thinking about that? What are some of the great strengths in our community that we can just keep hanging on to and go forward with?
I think, sorry, Tuila, I'm just going to go back to, just that previous question, because in regards to, and I would love to share Julie and Simone, I want to cling on to that kind of hope that you have. However, there's a big however, as Owen has shared, and I guess in terms of when we're talking about, like, this is just an avalanche of repealing quality evidence-based informed policies, interventions, initiatives. We're talking about probably, like the simple things in regards to removing the transport subsidies, for our tamariki, for our children, our young people, being able to, for families who are already doing it hard, at least there is sort of some supports that their kids could catch public transport to school. As of the 1st of May, that's gone. If we're thinking about, for example, I was involved in the landmark, our relationship sexuality education guidelines, and that was published, the refresh in 2020. And in that particular piece, purposefully, it was privileging te tiriti, Māori approaches, acknowledging worldviews, in Pacific as well, the needs of disabilities. So we've got, some really opportunities that we could have grown and learned from each other and created, open conversations. However, with the incoming government, they've decided no, they're going to scrap that. And at this point, they haven't introduced, as far as I'm aware, haven't actually acknowledged or noted what they will be using to inform how relationship sexuality education will be taught. And this is across both primary schools and secondary schools, where, this is the only formal instruction where our tamariki learn about well, meant to be learning about themselves, their bodies, their emotions, you know, consistently, you know, all the way through from littlies up until teenagers. So to remove that and all this fear mongering, I mean, your question about what can be done, and Jolie, your point about, yes, you know, we always turn back to our communities, you know, in terms of, you know, the mamas, papas, where we know though they are juggling not only work, not only children, you know, and still coming together because they see the need, and so they're doing it out of a place of love, heart, service, you know, wanting. But again, that is still they'll do it out of love, but unfortunately, you know, that comes at a toll and a cost as well. And how is it that we can awhi and support that? And it has worked in other spaces, Tawila, as you said, in terms of sometimes some great partnerships. And I'm thinking here in Mangere, you know, like our local Mangere East Family Service Centre, they combined, or they had support with local businesses in regards to, you know, some of the initiatives that were taking place, you know, so that they're able to put on family fun days. And so, you know, same in terms of foodstuffs and, you know, the local social, you know, supermarkets. And so I appreciate that there are definitely opportunities for our communities. We've got the leaders, but how is it that we can, you know, resource and strengthen those that are already stretched?
Yeah, I mean, it is, as you know, pediatricians, I've got two pediatricians on the panel with me, but you know, sometimes it's you know, we go through changes and new things happen, but we still look at the same thing, which is our kids die at 2 to 3 times the rate of other New Zealand kids, and it never seems to improve. So whatever we're doing, the big system is not being effective. But for what's your thinking about, we're sort of talking about the big challenges with the new environment that we're still not entirely certain about. What's your sort of take on it?
Yeah, and look, you know, I have to tread with some caution because I'm employed by I'm a public servant, so you know I can't comment too widely, I guess, on my own, I guess, personal opinion of this government. But I guess you know, over the last few years, you know, we've been you know, and particularly at our level, we've been, you know, sort of really thinking in that equity space, and you know, how do we address outcomes, or how do we build in social outcomes into the mahi that we do it, and I guess in the urban regeneration space. And you know, I think there's some words that were said earlier about navigating and being strategic and looking for the opportunity, and you know, that's the space or the environment that we're in at the moment. Is where we're looking for that opportunity. We're looking to navigate the current environment. I think from a housing perspective, we have a government that, like all the previous governments, that are focused on housing supply, which you know, which is, I think, positive for us, because we know that this government is focused on developing you know, housing in urban areas. At the moment, you know, we're sort of seeing some of that pegged back with Kāinga Ora and with you know, and the current environment for some of our build partners. But I think on a positive note for us, you know, our government's shown this government's shown some real interest in what we're doing in our space. I think the narrative from equity is kind of changing into this social investment approach. It's not new. It's not new to us. You know, we've operated under a social investment framework previously, so there is some sort of navigating around how we prioritize or target our Māori and Pacifica outcomes in our mahi, so that it aligns to, I guess, a social investment approach as well. And some of that is looking at what is the value impact of some of the things that we do. And if we can, you know, coherently and show with some clarity what the investment up front is and the long-term benefit of investing in programs, it's you know, that's something that we can we can build into our engagement with, with Wellington. I think one of the other things that we see quite often, particularly in place-based communities, is the community-led approach. And whenever there's adversity in communities always seem to come, to stand up and lead their whānau. And I think that's what we're going to see, particularly in our community. We've got our local marae, Rōpōtaka marae, has scaled up, and they're now, they're now wanting to do more in our community, and we're starting to see a lot of our other Pacifica organisations, putting their hands up and saying that they want to be involved. For example, we've got we're investigating partnering with and I can't say this, but we're investigating partnering with an organisation to provide an integrated health service in our community. So these are kind of the initiatives that we know that that are being community led, and that are that are really positive things for our Māori Pacifica whānau in our community.
Yeah, I think when we look at the Tamaki Regeneration Project, I mean, it's a great example of that holistic approach to children's well-being. It's place-based, you're building for families, you're looking at the structures that kids need in neighbourhoods. It's kind of what we need to be doing all over the place. So, all power to you. And it's great to see that it's been going for 5-6 years, and it's still going strong. So it's wonderful. Jackie, you've got your hand up. Have you got a question for us?
Yes, I do. And it's from Jean Tisina. So the question is, amidst the evolving terrain of education and healthcare under our new government and its policies, does equity genuinely endure in advocating for Pacific children?
That's a difficult question, but who would like to have a go at that? Julie? Simone? Okay.
Oh, sorry, I might just start by saying
Okay.
it may be reframing the kupu or the word equity may be helpful, because we still want to be responding to need. So when we look at the needs of our communities, our Pacifica children and our Māori children, we can see the needs are definitely much higher. So there is that kind of ability to rationalise and use that argument in a reframing sense. And I think that's what a lot of organisations are trying to do, that really have a heart for responding to inequities. And I just wanted to make a point about our earlier kupu, that our earlier kōrero around some of the initiatives and opportunities with the new government, and they did appoint a minister for mental health. So I think that creates some opportunity to have a really targeted approach to monitoring the mental health and wellbeing of our tamariki, of our mokopuna, and also highlight the social determinants of mental health as well. That may be an opportunity to further some of the work that's been happening.
Yes, it's I think it's wonderful that we've got a Minister for Mental Health. Simone, what's your response?
I'll just add to that and just say, there's so much intersectionality around these things. And yeah, I guess if we are using that needs-based approach, we know that health, education, poverty, housing, all of these things are so interlinked. And I think any advances for our Pacifica children will be of benefit. For example, they're in a healthy home and they can get some good sleep, then they can get a better education, and they can then have better health literacy going forward, and going into teenage years with analosa and going to the community clinics and be with their friends, and be empowered and educated to know what's going to be the right steps for their health. Not really answering the question, but just a thought that I've been having recently was, we actually have to trust our communities. We have to trust them as well, that when they have the right information, tools, access, that they will do the right thing for their tamariki. And I totally believe that. And so that's kind of that positive message that I've been trying to tell people as well. And some of my mahi is like, we do need to listen to them, we need to trust them, but we do need to also give them the tools to succeed in health, in education, in buying their own homes. And I just wanted to say around the housing thing, I think that's really exciting because we know that, you know, respiratory viruses, everything is linked to those sort of homes. And I remember specifically working out in South Auckland, there was a family come in, and there's not much I can do for their housing situation when they're telling me there's sewage leaking and there's rats and there's like 10 people, and you try and write letters of support, but actually to see practical programs happening is really exciting. So I just wanted to say thank you to all of you for all of your great advocacy and equity work. And I think to the listeners out there, I think, you know, there's still always going to be equity advocates, and it'll take a lot to silence a few of us, I think. So
yeah, I think we have to carry on, and sometimes you just have to you know, adapt and pivot. You know, I remember back in the Helen Clark government, they brought in the closing the gaps. Some of you are old enough to remember that, and then suddenly it became unpopular and the words disappeared, and we had to just change and just reframe, and we carry on, and just, you know, we never give up. So Jean, I'm not entirely sure we've answered your question. I might just ask Ana Losa to perhaps have a go at it as well.
I guess, you know, in terms of that second part, you know, of your questioning, you know, does equity genuinely endure in advocating for Pacific children? And, you know, there is no doubt in terms, you know, when thinking, well, we often hear it said that in terms of that value of service is one that's ingrained in many, in many Pacific Island cultures. And, you know, the sense of like, you know, you're not only doing this for yourself, you're doing it for your community. And that drives, you know, for many that are in health, education, social services, and law, you know, for many of the Pacific students that I've spoken to, the reason they chose their specific career path was it wasn't about them. It was about, you know, mum, dad, auntie, uncle, nana, you know, everyone that had that whose shoulders they stood on and that they wanted to support as well. And so, you know, that sense of genuinely enduring, we've definitely, you know, there's that real strong sense of, yes, service for our communities. And so, you know, just, I think, you know, those kind of important values, you know, that we, I'm thinking about my own children, you know, in terms of the values that they're raised in and how they're going to show up in Aotearoa, New Zealand. You know, the pathways and directions they make, they already have a strong sense of social justice or when injustice occurs. And so there's no doubt in my mind that in terms of the steps and pathways forward, they too will be taking, you know, the work that Pete, hubby and I have done and taking it that next step further. That's my hope. So, yeah.
Thanks, Anna. Also, I've got another question here. It's from Shanti, who's a paediatrician colleague of ours, and she's asking, thank you for this amazing talanoa. I take on board Afoa's comments, but there's a real need to shift the political narrative from seeing programs that can achieve better and more equitable outcomes for tamariki and Pacific children from being seen as costs rather than investments, even though we know this is about the future of our children and the nation's future. So I guess I'll throw that open. So yeah, there's a real need, isn't there, to shift from always looking for return on investment and things as costs, and children are actually the biggest investment we need. So who would like to have a go at that? Owen, do you want to jump in?
Yeah, so yeah, so I'm probably the pessimist of the group. I'm sorry, I don't know if I am hearing everyone else's optimism, and I do quite like the kupu of reframing. I think that's really good, but I have been alarmed by the ideological approach to some of these changes, that it's ignored the evidence, and so I'm a bit stumped on the way forward for the what I totally agree with Shanti that there's all sorts of things that investing in our children and investing in our society and investing in ourselves will actually save you money. You know, like as I went before, the influenza vaccine doesn't cost you money, it saves you money. But they appear determined not to view things like that, and it leaves me a bit stumped. I'm like, for someone who's fought for equity and all this sort of stuff and realizes and all of this, and that, and sort of, I think some of the arguments about the government got too big and unwieldy were probably true, but that doesn't mean you throw out the good stuff. You know what I mean? You pare back and do things carefully and have a look, and that hasn't been what happened. This has been a bonfire of almost spiteful retribution for whatever reason, like this, and people have been pent up for decades, a la David Seymour, to get his hands on the keys and so he can do what he wants to do, that sort of stuff. And it just seems so difficult to put that in our framework of life, which is more about caring and loving and investing and cherishing, and it seems to be so absent at the moment that I don't know how to approach that, because it's so far from what I hold to be good policy and good practice and all that sort of stuff. So so again, I'm sorry to be a downer, and I'm sort of hopefully it's not as bad as I think, but
it is difficult when we're sort of evidence. We come with evidence, and we want to use that to inform what we do, but that's not always the way with leaders. But Simone, you've got your
Well, I was just going to add to that about how it is a bit short-sighted. Children are the future, and if you're taking a life course approach, if we're preventing things in childhood like obesity, like many other things, and we're protecting and setting our children up to succeed, then I think so other countries have things like generational ministers who check that what policies are being implemented is going to be safe and productive and helpful for our future generations. And I think maybe that's something that New Zealand should consider, because perhaps we need a different lens over some of these policies. But
Julie.
See, I'm jumping in already, and I just want to do a shout out. Shanti, great that you're joining us, because when we're thinking about those advocates for our Pacific and Māori children, I just want to acknowledge to those that are joining us in terms of the work that Shanti's done in this space, in terms of informing planning and design. And I remember her sharing in regards to, for example, how it is land developers, the use of, for example, driveways, and the number of childhood driveway incidences, and just being at that table and having those conversations and discussions, going, actually, these are kind of things you need to take into account. And so just want to shout out to another strong advocate.
Julie,
I was just going to comment that the government have been very upfront about focusing on the now and very short-term focus on wanting to reduce costs and meet short-term targets. So our traditional way of advocating and influencing policy change is not working. It's not being listened to. It's being blocked. And a lot of strategists have talked about, so what's the approach to advocacy now? Like, how do we ensure that, we're not going to go 10 steps backwards instead of moving forward in terms of our children's wellbeing in Aotearoa? And some people have talked about a different approach of getting alongside ministers and getting alongside government, establishing relationships of trust, doing our Māori and Pacifica way of being with people in relationship and trying to work alongside them in a leading, guiding way. Because the knocking on politicians' doors at this time is not working. There's such a strong focus on the short and immediate, and the long-term vision that we have that is needed for our children's wellbeing is not being taken into consideration. So we've got to kind of go back to maybe 10 years ago to how we might have been navigating these types of situations. And I agree, Owen, I love the realist perspective you're bringing. It's really frustrating because, you're on the front line. I work in mental health. We're seeing what these sorts of policies are how they're going to impact the lives of the children we're serving and their families. So it is really challenging. So it's up to people that are able to establish those relationships with people of influence to start to kind of navigate and hold them to task.
Yeah, and sometimes we also just have to hunker down, I think, and just carry on, which is what we always do in the front line. There's a really nice comment here, which I'm just going to share with you, from Dean Viviani, and he says, "Do not be disheartened. There will be opportunity, innovation, and victories. You must prepare, look to those around you, and take strength in them." So that's very, very, very nice from Dean. I mean, one of the things, you know, we saw when we had the big floods in Auckland over a year ago, and also in COVID, but, you know, remember when we had those floods, how slow was the system and the structure and the powers that be to move things. And, you know, the next day it was the community that set up the halls and all the resources. So sometimes we just have to hunker down with our community, I think. Yeah, difficult times. There's another question here, which, oh, Jackie, have you got another question for us?
I think it's the question you were looking at, but that's okay. It's from Josh Alifalongo. How do we include more children in decision-making frameworks, especially in spaces such as health and urban design? That's from Josh. Thank you.
It's a very good question. I'm going to start with Anna Losa, who's done this. So you're on mute.
Yes, apologies. In terms of, and actually it's the team at Moana Connect who actually provide a really amazing example of actually involving and including children in regards to decision making. And I'll in terms of, there's some great development happening here in Mangere 275 Hard team, and the actual team, they brought in the children alongside the actual architects, involved, and in regards to, and it was, when we're talking about child-centered, child-centric, it was actually, our young, what we would traditionally would have, pen, paper, ask the questions, but actually it was interactive. It was providing with role, like clay, images, toys that they're able to construct. Actually, what brings you joy? What do you enjoy when you're hanging out? What are the kind of things that you like to do? And actually, having the designers in the room actually, and when the children are able to they had time together, they came back and shared to the other peers. That was actually really enlightening, for the design, developers, designers that were actually in the room. And so, I'm aware that we have Jacinta, who has done a fascinating piece of work in regards to her research, involving children, and the resilience of children and hearing their voices. And so I think we've got some great leaders, great examples of how we do meaningfully include children in decision making and in terms of services that are designed for them.
And I think our previous Children's Commissioner did a lot of work talking with children and young people, finding out what really mattered to them. So that's another great example. But for what about in sort of like your urban housing design? And are you involving children, or are you thinking about involving children?
I think, yeah. Look, I think in the urban development, or even in the master planning, how we master plan our built environment, I think there's a lot that we can learn from design principles, and the industry is so, how do I say it? It's very professionally led. So it's and quite often, it's a group of people sitting in a room designing blocks on a page. That these are the people that are designing our communities, and more often than not, they're not co-designing that with, I guess, the end user, which is our whānau, which is our children as well. So yes, I think to answer that question, we do need to include more, or there needs to be more inclusivity of our community into how we design our neighbourhoods. And one of the ways that we can do that is obviously through, there's some great examples of organisations across Auckland, like the Cause Collective, Moana Connect, the Village Collective. We don't have access to that type of, to an organisation like that in our area. But one of the things that we do well is that we're very connected into our community. So we're actually getting a lot of, I think, a lot of that framework from within our community. But with our children, probably less so, and it's probably something that as we're moving forward with, designing an extra 10,000 homes in Glen Innes and Panmure and Point and Glebe, we're definitely going to need to be more inclusive with our approach, you know, with our community.
Thanks.
Oh, sorry.
Sorry, Julie, yeah.
Yeah, I was just going to add about advocacy for our children, for our mokopuna, and with the Children and Young People's Commission, the advocacy approach is about doing that alongside and with our young people. So all the advocacy that's presented in submissions encompasses mokopuna and children's voices, so that it's their voice that's being shared. I think we really need to start thinking about making mokopuna decisions. The decisions we're making now are for the future of our children. So engaging them in all decision-making processes is really, really critical and important.
And I was just going to add about frontline health. We know from the research that, you know, the children's voice in a consult with the doctor is like 1-2%. And so, you know, how can we amplify the voices of our children in that? And I think that's something that we need to go back to the healthcare workforce and ask, but also around trying to adapt our healthcare system and decision-making towards shared decision-making, you know, beyond the whānau and patient-centered care models, actually saying here we're empowering you with the education, and what's going to be the best decision that aligns with your values, and actually involving children in that. And I think particularly with things like chronic illness, that can be really important. And then as they go from younger children into youth, you know, youth is something that is always difficult to engage children to better their health. And I think, you know, there's a lot of different ways that we can do that better going forward by actually asking them. So it is still quite a novel concept though, but good developments in that area from what I can see.
I think children always surprise us at how sensible they are. You know, you can talk to an 8-year-old about, you know, their health condition, and you know, they're often very sensible and understanding, and you know, you just got to spend time, I guess. We're all parents here, so we kind of all know we have to spend time, don't we? We're sort of drawing to the end of our webinar, but I wonder if we could just perhaps go around the panelists, and the focus is advocacy, looking forward. Perhaps just a couple of minutes on what you would really like us to focus on as a community, as a country, even in the next couple of years. Start with you, Ana-Losa.
Yeah, I've been really thinking about, you know, in terms of, you know, as Owen, you know, shared in regards to this current political climate, you know, and we know that we have many champions who have seen various different successive or different governments. And I also want to acknowledge, you know, one of our attendees, Eseta Finau, who's, you know, raised a question for us as well, you know, in terms of all the championing, all the work, having to navigate through various different governments, priorities. And I guess it's that kind of question and the kind of, in the situation that we're in, how is it as a whole, you know, when we talk about collective, how is it that we can leverage and work with each other, you know, and just in terms of, you know, I know that we all sense that, that frustration, despair. We know that with 2,000-3,000, you know, job losses within the public sector, we will know someone who was affected from these cuts, and their family and their children. You know, and so how is it that all of us as a whole community are actually able to draw on the strengths of each other to move forward in this particular climate? So yeah. Sorry, Tuila, I think you're on mute.
Oh, I was just going to ask Jackie, is there something you wanted to add before we go around the group, or you got your hand up?
Oh, sorry, there was just a question. Just this last one. How do we motivate collective movement for transformation and change across the board for our Pacific children and their well-being, when a lot of that motivation and work has been put on the shoulders of our Pacific communities? That's from Moana.
That's a bit tricky, really. it's often the way that you do end up, we do end up doing most of the work ourselves. But anyway, I'll hand it over to Simone. Do you want to have a go at that?
Yeah, thanks, Tuela. I think that specifically from like the research space and the co-design, I think we're wanting to acknowledge the time and with koha and things that we're not just expecting all of this from the community, particularly when, we're not acknowledging how much they're actually adding. So I think that it's my hope that ethically, we're not putting too much onus on them, but we're actually just wanting to partner with them to make things more suitable for their needs. And I do just want to reflect on the last question about, actually every group from the Pacific have their own different cultures and their own different needs and values and ways of being, as with our tangata whenua here. And I think that there are similarities between them, but we also do want to draw out the strengths of the difference. And even in saying that, in my own research, culture is so unique to each individual. And I think that that's something that we also need to acknowledge in these spaces. So it's a complex web, Tuela, but I think that our people do hold the answers of what's best for them.
I think what the question is sort of getting at, which is something we all struggle with, is we feel a responsibility to just keep doing more, and to not do that is, we kind of can't do that. It's just such an unethical, shameful thing for us, and we feel that responsibility, and it's a big burden. It is, but on the other hand, there are great things to be gained from it. But should we keep going around and just again, just what do you want to focus on going forward? What are the big things you'd like us to do? Perhaps Julie, if you could just answer that.
I was also just reflecting on the last question as well, about that huge sense of responsibility. And like when we do our mahi, it's not mahi, it's like our purpose, like that's what we live for. And so we are so heart connected to our mahi. What I find helpful in my own work when I feel overwhelmed is looking for our allies, and they might not be within our own cultural groups, but they are allies that have shared vision for what we're trying to achieve as well, and they can be a great source of support. I guess one of the focuses I've been thinking a lot about is how we start to get that, I raised it at the beginning, that kind of cross-party commitment and long-term cross-government approach. How do we start those conversations? I know they've already been on the table many times across a cross-party approach to responding to poverty in our nation. But I think it's time to really renew that focus and start to get some investment in that space. So I think for me, that's an area that I'm going to be like wanting to work really strongly on, and alongside anyone that's ready to work really hard towards that as well.
Thanks, Julie. Owen, what about you? What would be your big focus for us over the coming couple of years?
Yeah, I think we've got to keep doing what we're doing, don't we? I mean, and keeping it simple. I think particularly for those of us in the front line, the issues we will have are going to be exactly the same as the issues we had yesterday, and it'll be in the morning. It's just that it'll be firefighting more than we would like, rather than trying to advocate for that. But I think we should still advocate. I think we have a duty to do that, and it'll be frustrating and it'll be hard and everything like that. But I agree, it is our purpose. It is what we want to do. We see the truth, and that eliminating inequities, whatever they are, is by far the biggest gain for our society, both economically and socially. Whether they're equal pay for women, or housing for poor families, or feeding our poor kids at school. We realize that, and we just got to keep on going there. We know this is the truth, and we can't miss that. Whereas other people live in a different truth that I find very hard to relate to. So I think we carry on, and go from there, and try not to be disheartened, and dream of a future. Anyway,
Thanks, Owen. Afoa, what about you? thinking ahead next couple of years, what would you like us to
Yeah,
focus
look,
on?
I think top of mind for me really, particularly in my line of work, is around creating more, I guess, opportunity in housing for our Māori and Pacifica whānau, whether that's really good, well-built public housing, or whether there's housing that's available for our whānau to purchase. I think, like I said previously, housing is a real catalyst for social and economic and health well-being for our families. So, top of mind for me for the next couple of years is really trying to, I guess, address that. We have a shared home ownership program in Tamaki that we've had running for the last 3 or 4 years, where we've placed around 90 of our Māori and Pacifica whānau into home ownership. And we can already see the benefit, or the benefit of a place to call their own, and how that impacts the well-being of families. So I think, I just want to do more of that. I think for this, I just want to kind of address that previous question, because it is a really good question about how do we collaborate across the different sectors. And I think cross-sector collaboration, again, it's not a new thing. We've been talking about it for so long. But I think in this environment, it's really important, because I look across and scan across the different agencies, organizations, some of our consulting firms, and there are a lot of Pacifica leaders out there. And I think this is the time for us to sort of not come together, but to look across and see where we can collaborate. This is an example. This forum is an example of that collaboration, where we get to sort of venture outside of our comfort space, and look at some of these issues from a different lens. And I think this has been really helpful, and it's probably one step to being able to connect wider and collaborate wider across some of our leaders. So thank you.
Yeah, I think that's a really important point, isn't it? It comes down to relationships. As Julie was saying, we can sit and think about policy and documents, but if we can build on relationships in all the different ways we can do that, it might, it's always going to be a way forward, isn't it? I remember many years ago, I had a research project in one of the Pacific Island countries, which I won't name, and we came up with very good evidence for a particular thing. But the thing often is that leaders don't necessarily want evidence. What they want is they want to look good and be on the front page of newspapers for the right reasons and not the wrong reasons. And sometimes, we all the evidence in the world is not going to change what's our leaders are going to implement. Sometimes we have to, as Julie suggested, focus more on getting alongside people and looking at what's important to them, and building our relationships, and changing times. That might be the way we have to move in terms of trying to advocate more for our children. But it's been really nice to listen to you all, and thank you for sharing your views and your wisdom. I think we need to keep our eye on the ball and not forget that we have to keep activating and advocating for children, and not be willing to just accept that our kids are suffering and continuing in poverty and everything like that. And we just need to keep on. Owen, and as frontline paediatricians, we do get frustrated. We feel like we're banging our heads against the wall sometimes, but we do carry on. I guess the great wins we have as frontline clinicians is we get to work with people and as individuals, which can be very rewarding. But thank you everybody. It's been really nice, and I think there's been some good conversation, and thank you to the people who tuned into our webinar and for your very insightful questions. Thank you for giving up your time, much appreciated. And all of us want the best for our children, and looking forward, we want to keep on keeping on in our work. And hopefully you will leave this evening and not be too disheartened, and have some thoughts to carry us forward. And for us paediatricians are very keen to work with you. So we've made the relationship now, so we're happy to help you with your designing out there.